we now have a word called diabesity. And the increase in obesity has led to an increase in diabetes. For every 2-pound increase in weight, the prevalence of diabetes or the risk increases by about 9%. So we'll look at these every 2 years, not as many maps. But in 1995, there were really almost no states over a prevalence of 7%. This is for diabetes. And only 2 states over 6%. And 34 states that were less than 5%. And watch the colors change to the ones that are down at the bottom, the darker red and purple. 97 was just Puerto Rico. Now you've got a few more. 99, 2001, 2003, 2005. So now, instead of what we saw in 1995, in 2005, there's only one state, Colorado, that's less than 5%. And there are 43 states over 6%. So the increase in obesity has directly led to the increase in diabetes, and that's the concern. So I often get asked, is this a disease? And the answer is, you bet it is, because 2/3, 65% of 5 to 10-year-old children who are overweight will have at least one heart disease risk factor, and 25% will have 2 or more risk factors. And these are some of those risks. Cardiovascular, we have hypertension. There's already signs, if you look at the neck blood vessels, the carotid vessels, of heart disease, of narrowing of those vessels. Type 2 diabetes, we used to call that adult diabetes. We don't anymore because we see this in children now. I had 2 10-year-olds a couple of months ago, 2 10-year-olds in 1 week who came in with type 2 diabetes. The dyslipidemia, that word just means the abnormal cholesterol, the abnormal lipids that we see that predispose to heart disease. Sleep apnea, where children are falling asleep, which can be very dangerous because they can stop breathing. More deformities of the legs, more fractures, liver disease, kidney disease, young teenage girls with polycystic ovary disease, and then, of course, the psychological effects, the depression, the low self-esteem. Teenagers with obesity have often self-described themselves as having a lower self-esteem and self-image than children with cancer. So another question is, is this our genes? Is there something we can do about it? What's the role between genetics and the environment? Well, it's true that we are affected by our genes and our heredity, but our genes have not changed. And this problem is occurring not just in North Carolina, not just the United States, but all over the world. In China, it's 20% now. So as people adopt our lifestyle, then the problem appears. So our gene pool hasn't changed, but what has changed is our environment. And it's really the societal factors that are driving this epidemic. And let me give you an example. When immigrants move into the United States from other countries around the world, the prevalence of obesity is about 8%. After they've been here 15 years, it's 20%. Their genes didn't change, the environment did. So what are the factors then that increase this? And there's a little balance there because we are out of balance. And when we take in more than we burn up, we're going to gain weight. So the factors affecting our intake are the meals away from home, the portion size, the snack foods, and the sugar drinks. And as far as our expenditure, our output, it is the decreased physical activity, which is at home and at school for children, and the increased inactivity or screen time, because it's not just the TV, it's the video games and computer as well. So we're now going to look at some of these factors in more detail. So if we look at our dietary practices, only 20% of children have the recommended 5 a day, the 2 fruits and 3 vegetables, and the new recommendations are for more than that. 30% of the vegetables are French fries. The French fries in Forsyth County used to be 60% fat. They're now 30% fat. They were changed. Fast food consumption makes up about 40% of the budget, and soda consumption about 15% of our calories. So what are our kids eating at school? About 70% is a la carte, and 23% comes from vending machines. This is a major change. This is a major change. And if we look at our school breakfast menu there, you can see the breakfast pizza, the ham biscuit, the sausage biscuit, the cheese biscuit. As Ed said, those of us who've grown up in the South know ain't nothing you can't put on a biscuit, right? Okay. And for the school lunch, a la carte, the pepperoni pizza, the juice drink, The fries, you know, when you go to a pizza restaurant, you may get breadsticks with your pizza. You don't get French fries. But you can in school because the French fries count as a vegetable, and then it's a federally reimbursed lunch. So here's the drinks, and they are getting bigger, as you see. So we refer to sweet drinks as soda, juice drinks, sweet tea, Kool-Aid. They're all the same. It's not the soda water that's the problem. It's the calories and the sugar. So this sort of dates me, but I used to drink a 6-ounce Coke. That was 75 calories. We'd freeze them at this time of year. 12 ounces, 150 calories. One 12-ounce a day is 10 to 15 pounds a year. I'll show you some data. 20 ounce, 250 calories. That is 20 to 25 pounds a year, just one a day. 40 ounces, 410, and the 2 liter that some of my patients drink is 830. So I see many kids, I just saw one the other day, taking in between 500 and 1,000 calories of sugar water a day. And if you look at this, and this is from the American Beverage Association, looking between 1970 and the year 2000, and you note that red line, so that soda consumption has gone up, and this is their data, from 25 to 50 gallons per person per year. Okay? Water's going up. That's encouraging. Unfortunately, milk is going down, and we're seeing osteoporosis in teenagers now. So now we're going to turn to the other side of the equation, and that's physical activity. And that's gone down in our society. Only about half of our young people regularly exercise as far as vigorous or moderate physical activity. 25% have basically no activity, and school PE has gone down. Now, in North Carolina, the State Board of Education requires 30 minutes of moderate to vigorous physical activity for every child, but it's only kindergarten through 8th grade, and that's not enough. And I'll show you that right here. So this was a study of 1,000 kids, 500 boys, 500 girls, and they looked at moderate to physical activity, and they did that by accelerometry, which is like a fancy pedometer. And they looked at them at 9 years on weekdays and weekends, and it looked good. Almost 99% of the kids had the recommended 1 hour of physical activity a day. It could be a half an hour at school, a half an hour at home. But by the time they were 15 years old, that was 30% on weekdays and 17% on weekends. And so that's our challenge. I think we need to extend that regulation or mandate or whatever from 8th grade all up through high school. It'll probably have to be voluntary. It will probably have to be 1 grade at a time, but we definitely need to work in that direction because these are our kids who are not getting the activity. So what can we do? Everybody knows they need to do something. Maybe you could start out. We do need a starting point, as Ed said. Maybe we could start out by just walking the dog. Be careful you don't wear yourself out. And some of you may be a little more highly motivated. You're gonna go, as they did, and join the fitness center, but just don't wear yourself out going up those stairs. Take the escalator. So what should we do? What should we do in regard to physical activity? Well, we need to establish activity as a normal part, not an occasional part of our lives. You know, the recommendations for children, it's not this 2 or 3 times a week. This should be most days of the week, almost every day, whenever we can. We should plan weekend activities. We need public facilities. That's where we need our parks and recreation centers and activity programs. And you know, you and I are taxpayers. I think we need to ask, why can't we use? Some of our schools have superb physical facilities. Why can't we use that, at least for the parents whose children go to those schools? That would be another resource for our communities. We need to support participation in non-competitive as well as competitive. My dunk shot's not all that good. I was not going to be the star of the basketball team. And we need to have physical activity also with whatever they can do for our children with special needs.